Thank you for tuning in. I'm your host, Neal Howard, here on Health Professional Radio. So glad that you could join us. Pancreatic cancer is a disease in which malignant cancer cells are found in the tissues of the pancreas. Our guest today is Dr. Iman El-Hariry. She's the CMO of Erytech, and she's joining us here on the program today to discuss positive results for their Phase 2B study of Eryaspase for pancreatic cancer. Welcome to Health Professional Radio, Dr. El-Hariry.
Hello, and thank you.
Give our listeners a bit of background about yourself and then talk about your role there at Erytech.
So I am Iman El-Hariry. I am the Chief Medical Officer at Erytech. I joined the company almost just over 2 years ago. I had a long track of drug development experience in oncology, which is my medical background. And prior to Erytech, I worked in other large pharmaceutical organizations developing cancer drugs for cancer patients.
Erytech, a clinical stage biopharmaceutical company, meaning that you all deal in lots of clinical trials.
It is correct. So typically for any drug to be developed, it goes through a series of activities, starting from working in the lab, looking at the best approach to bring this drug to the clinic. Once it goes in the clinic, again, it goes through a phases of clinical trials until the drug is shown clear benefit and low risk to be able to get it approved by health authorities, for example, like the FDA in the United States or, for example, CHMP in Europe.
Your company has just announced some very positive results from their Phase 2B study of Eryaspase. This is one of your products that can be used in combination with chemotherapy for the treatment of pancreatic cancer. Talk about this study as it relates to pancreatic cancer.
Yes, absolutely. This is a trial which it's what we call it's a Phase 2 proof of concept trial where we looked at the clinical activity of Eryaspase in combination with chemotherapy in patients with a pancreatic cancer whose disease came back after treatment with other chemotherapy agents. And so, Neil, this group of patients who we call second-line disease or eligible for second-line treatment, typically these are patients with generally poor clinical outcome, and survival is not typically great in this patient population. And so this trial really looked at whether the addition of Eryaspase could perhaps improve the clinical outcome in these patients. And so this trial was conducted in 141 patients. In fact, actually, the trial was completely conducted in France, in several centers in France. And these patients were randomized to receive either the standard of care, chemotherapy, or the standard of care added to it, the Eryaspase treatment. What this study showed is when you add Eryaspase to the standard of care therapy, it actually led to the risk of reduction of death by 40% in the patient population who were treated with the drug. Also, it has prolonged the time until the disease came back, and in fact, actually more importantly, it also improved the response rate on the treatment. So this is really a very exciting, very interesting development, particularly for this disease, where survival is typically around a ballpark of 4 to 5 months. So by improving the survival in this patient population, it opens a new alternative options to improve their outcome and their prognosis.
You're talking about second-line patients. These are patients, as you said, if I'm understanding correctly, that their disease has come back after being treated with traditional treatments. Is that correct?
It is correct.
Okay.
Unfortunately, pancreatic cancer is one of those diseases where it is generally diagnosed very late. Very small percentage of patients are eligible to have surgical treatment, but most patients, when they are diagnosed with pancreatic cancer, they are really requiring systemic chemotherapy treatment. And this is either across Europe or United States. So basically, when these patients are treated, there is a decent proportion of patients where, unfortunately, the disease comes back, and this is when we call it a second line. So they are eligible to receive a second round of chemotherapy, perhaps to alleviate the symptoms and to treat their disease.
Is there any instance where this new treatment can be implemented upon diagnosis, or is it always after we wait and see if the pancreatic cancer is going to return after the initial treatment?
Well, this is a very interesting and very good question. Typically, at this stage, what we have investigated is the addition of Eryaspase in combination with chemo in a second-line setting. Clearly, with this interesting news, we will also like to look at other settings. For example, whether patients, when they first diagnosed, can be treated with chemo and Eryaspase, i.e. first-line setting, or in the future could be also looking at the time of diagnosis, maybe before surgery. And there are now new trials that show that treatment with chemotherapy before surgery is, can lead to improvement in at least in the surgical outcome. So yes, in the short answer, there would be interesting opportunities to test Eryaspase in different settings for patients with pancreatic cancer. And at this stage, this is the first set of results that we have generated in this disease.
Talk briefly about a couple of the other products that you're developing there at ERYTECH that also deal with cancer.
Absolutely. Eryaspase, actually, it's the first drug at Erytech where we not only we are testing it in pancreatic cancer, but also in other hematological cancers such as acute lymphoblastic leukemia and acute myeloid leukemia. So these are trials in phase 2 and phase 3. So it is a later stage development. We do, however, have other drugs that currently still at the lab stage, where we're looking at the activity in maybe different tumor types. But the overall arching objective here at Erytech is developing drugs that can deal with cancer metabolism. And so, as you know, Neal, cancer metabolism is actually one of the oldest areas of research in cancer biology, even before the discovery of the new oncogenes and tumor suppressor genes by almost 4 or 5 decades. So what we're doing here is looking for new agents to tackle cancer metabolism, which can certainly lead to an improvement in this disease outcome. We have 2 drugs in the pipeline right now. We are also looking at immuno-oncology agents. So, in combination with also these agents that are targeting cancer metabolism. In terms of different tumor types, clearly, the door is wide open for us, and again, with the results with Eryaspase, it's providing a very initial interesting paradigm for us to go into other diseases as well as other targets.
Well, we'd like to go online and get some more information about your company and some of these groundbreaking treatments that your company is developing. Where can we go and get more information about Erytech?
Our website has the information about our drugs, some of the presentations that have been presented publicly in medical conferences, either in Europe or United States. So this is a good start for additional information.
Well, I appreciate you coming in and speaking with us today, Doctor.
Thank you very much, Neal.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Dr. Iman El-Hariry. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to the podcast on iTunes, listen in, and download at SoundCloud, and visit our affiliates page on our platform at hpr.fm and healthprofessionalradio.com.au.